Okay. All right. Thank you all for joining us today, online and in person. We got a great big crowd for a great big speaker. I'm excited to introduce Dr. Leo Trasande, an internationally renowned leader in environmental health. His research focuses on identifying the role of environmental exposures in children and childhood obesity, cardiovascular risks, and documenting economic costs for policymakers failing to prevent diseases of environmental origin in children proactively. He has served as a member of numerous scientific committees and expert panels, including the American Academy of Pediatrics Executive Committee of the Council for Environmental Health, the Science and Technology Advisory Committee for the World Trade Center Health Program, the National Children's Study Methodological Review Panel of the National Academy of Sciences, the United Nations Environment Program, Steering Committee on Global Outlook for Chemicals, and the Board of Scientific Counselors for the National Center of Environmental Health at the CDC. He represents the Endocrine Society as an observer to the global plastics treaty negotiations and is an author of the forthcoming WHO UNEP Second State of the Science Report on Endocrine Disrupting Chemicals. After receiving his Bachelor of Medical and Public Policy degrees from Harvard, he completed the Boston Combined Residency in Pediatrics and a legislative fellowship in the Office of Senator Hillary Rodham. Leo is an outstanding speaker that I've had the opportunity to meet a couple of times and see in person. And I think you're really going to enjoy hearing from this amazing speaker. I also want to thank the Department of Pediatrics for welcoming Idaho Clinicians for Climate and Health and the St. Luke's Sustainability Division into the Grand Rounds meeting. I think it's a great opportunity to bring two different groups together and expand our audience. And I'd like to invite you all to join the rest of our lecture series, which can be found on the St. Luke's website. Without further ado, I'd like to introduce Leo Trasande.
Thank you. We did not color coordinate today, just for the record. And tomorrow we have some talks where I switched to a maroon color. So I want to be clear, this is not, what I'm going to talk about is not a partisan issue, my biographical aside. So I recast this talk a little bit because I wanted to appreciate and honor the fact that the world of plastics is having a bit of a moment in the social consciousness in general. So I'm going to start with some media examples of what you're hearing. So already coming into the room, I had the privilege of talking with somebody about a new documentary that's out on Netflix called The Plastic Detox. That's a good Q&A thing in terms of what I feel about the movie. There's some mixed feelings. I'll just leave that there as a little tweet to build off of later. But what I do want to emphasize, if I can get my pointer right here, is the pointer.
No, the pointer won't.
No pointer. Don't worry about it. It's all good. But if you go from up to the right, you see that there's a lot of attention to solutions, right? We all appreciate, well, I'd say a large majority of the US population actually appreciates, and that's actually borne out by some survey data. They appreciate this is the problem, right? You see people putting sponges that are plastic free. There's a lot of marketeering out there. A plastic free, bisphenol A free was already a thing. BPA, we'll talk about that. Baby bottles and sippy cups. We've also talked, you've probably seen some manufacturing and marketing around phthalate free, that PHTH word that I grit my teeth about saying because it makes people have a hard time with spelling or feel guilty about it. You shouldn't feel like that has to be a thing. And you also at the same time have a lot of confusing and mixed messages. So on that lower right, you see a study that came out from France saying, ooh, glass bottles have more microplastic than other containers. And that was a bit of a mismessaging moment. It was really literally the paint on the cap that was plastic-based that contaminated the glass bottle. So people then said, well, you shouldn't drink glass. No, I'm going to leave you already an early takeaway that stainless, I have two props here, right? Stainless steel and glass is much better than this. But if I'm on an airplane and I've run out of water, I'm still going to hydrate. because the nephrologists in the audience are going to appreciate that hydration is really good for the kidneys, not to mention other body compartments. So, and at the same time, as you run through, there's industry doubt on the lower left. Lately, there was a weaponization of some scientific controversy and debate. Scientists still debate, and that got weaponized into, well, the science of microplastics is lousy. We don't really understand plastic effects on human health. That's not true. There's one thing I can leave you is we have a long way to go about micro and nanoplastics, but we know that plastic leaches chemicals in plastic, either the ones that are used in the manufacturing or contaminants that are inadvertently or intentionally added. And those have a large body of evidence going back 50 plus years at this point. So we know enough to do something about it, and there are safe and simple steps we can all take. They don't require a PhD in chemistry, and they don't have to break the bank. Now, further adding to confusion is there's a lot now of marketeering around clinical testing for plastics. Now, I don't know if you know Brian Johnson. He's a pretty widely known social media influencer, especially in the manosphere, if I can just pick on one sex. But, my own. And so, he is marketing out there this test. And he's a bit of a biohacker, right? If you haven't heard about him, Google him. But, he is marketing this test where you do a finger prick. And you can send this off to the lab and you can find out how much microplastics and what size. Now, I don't completely dismiss what he's saying. What he's saying in theory makes sense, but last I checked, there's plastic and dust. And, yes, an alcohol swab will wipe off some dust, but it won't wipe off all the dust. So from the moment you're pricking the finger, you're contaminated in your sample collection. You're not really getting what you might do in a proper venipuncture if you were really trying to be plastic-free in your collection technique. And you can see that people have brought this price point down. There was a recent announcement from the Environmental Protection Agency and Health and Human Services that is trying to put a moonshot, if you will. Wrong administration metaphor, but I'll go with it. And they want a $50 microplastic test in 15 minutes. Now, I think this is all noble because I do firmly believe that we are having a bit of a 50 years later lead moment. What I will put out there is the evidence was not perfect in the 70s for lead effects on the developing brains of kids, but we had a test. We measured blood levels, we acted, and lead levels spontaneously declined, and kids are 4 to 7 IQ points smarter than people like me who were born in the 70s. I'm guilty about that. That might be my conflict of interest to put out there. And so this is a space to watch, and it's a space that will continue to evolve as we talk about this. This is actually a legitimate test that Quest Diagnostics has put out, but the issues here are the price, $350, and the fact that insurance companies have already put a brick wall around this, except in New Hampshire where it's required for health insurance coverage, saying that it's experimental. But the National Academy of Sciences will tell you that 150 million Americans should get this test or an equivalent one from a CLIA certified laboratory. And we'll talk about why in this presentation. So having added some suspense, there's a reason I also added the suspense, because I'm going to depress you for about 25 minutes before I give you the hope. And that's a bit of my game now. But, and at the same time, I want to leave you with the other cliffhanger, which is there's a lot of marketeering going on about what you can do to get microplastics out of your body. They want the chelation. They want the EDTA for lead, except for microplastics. And people are saying, well, kimchi will get out your microplastics. There's a microbiome modifier that's being marketed by a company that I'm in some early discussions with, potentially actually doing something scientifically, because I think we have to lean into this at some level, and we do have to try at the same time. But there already are things that we can do behaviorally, that we can talk about with our leaders, decision makers, and really have individual as well as global action in this space. And I'm going to try to take us in all the way from individual to city to state to US to global in this presentation. So I'll go fast. And I have a lot of ands in my beginning of my talk now. I'm not here to tell you that plastic can't be essential. I will acknowledge I've intubated babies. We were talking about this. I haven't practiced since the pandemic. Things got a little busy in the research front for me. But I missed my general pediatrics practice at Bellevue Hospital, the flagship of the New York City public hospital system. So you get a sense of who I took care of there. We give nebulizers for kids with asthma, adults with COPD, get treatment through plastic. Dialysis, we would not be ECMO, all plastic in those devices. Now, we have to work on reducing our plastic footprint because we are part of the problem. For the stat that is not here on this slide, it's probably a little later, is there 14,000 tons of medical waste each year in the US. A quarter is plastic at minimum. And there are studies that show that a lot, and I'm sure you feel this, I'm not gonna, Ethan's gonna be mad at me, not only because I'm a Mets fan, but also because I'm gonna impugn the ER a little bit. So a study at UCSF in their pediatric emergency rooms took suture kits and looked at what was left of the suture kits. 75% of it was just wasted plastic. So we do have a system problem here that we need to work on. Now, there's a lot more we can do at a patient basis and at a population basis, so we'll focus on that. But here are some stats to put some further global frame and maybe, make you feel better or worse, depending on how you want to think about it. But we are going to treble our plastic production by 2040. And it's going to happen in lower and middle income countries, especially. Much of the plastic moment is before us. The plasticine is here in the US of A. It's growing. And it's growing for a variety of reasons, particularly because we will talk about fossil fuel consumption and production a bit because plastics are byproducts of fossil fuel, whether it's oil or gas, gives you ethylene or propylene. That is turned to polyethylene and polypropylene. Vinyl chloride comes from that as well. And so we use fossil fuels to make plastic. And many of the countries in the planet that are hearing about climate change, if I can say that, right? But they are off-ramping from burning fossil fuels to making plastics with their fossil fuel byproducts as a so-called safer solution. And that's going to create some problems down the line as well here. We do have the planet in a plastic bag, proverbially speaking. I hope it's safe to talk about ecological effects and climate change in this audience. Then I'm going to get quickly to human health effects, and particularly the endocrine system. I'm not an endocrinologist, but I play one on TV. But the ecosystem effects are real. We have cumulatively made a mess of the planet. 9% of plastic ever produced has been recycled. 91% is left to controlled and uncontrolled landfills. Export, which creates controlled or uncontrolled landfills, it's a circular loop there, or it gets burnt. When you burn plastic, you create dioxins. Dioxins are very potent carcinogens, and they unfortunately are unintended byproducts of plastic waste or incidents that go with plastic in addition. Here's the stat that I forgot my order of my slides because I'm giving so many presentations here in Boise. So this is the stat that really speaks to the huge amount of plastic medical waste that we are dealing with and the exponential rise. And there's the picture with the ER, which drives that home. Sorry. But back to visible and invisible as a theme of this presentation. The reason why we haven't talked about this so fervently as a human health issue is because you see plastic waste on oceans. You see plastic, you see this turtle getting caught. It's macroplastic getting caught in this nostril that it got people's heartstrings, right? As much as I'm going to focus on wildlife as the proverbial canaries in the coal mine, it's also a really good analogy for what we deal with in a human health perspective, because you may not see the macro and micro nanoplastics in human samples, but we are just so much like wildlife. We are higher on the food chain, if you will. And ultimately, what we already know about micro nanoplastics is that they induce a whole host of biological mechanisms that are problematic for survival of wildlife, which should mean we should be freaked out as a society. It contributes to inflammation, it disrupts microbiome, it induces changes in carcinogenicity through genotoxic and hormone disrupting mechanism. All of the things we're going to talk about in the right, we've known about, is my point, in wildlife for much longer, because we've had an easier time studying in controlled settings the effects of these things. And it's much more difficult to study them in humans because you can't really run randomized controlled trials of toxic materials or potentially toxic materials. That's just not ethically going to pass. Drugs are a different story. They're intended for benefit, whereas plastics are not direct benefit. I'm going to dwell a little bit on climate change here, maybe less than Ethan might want me to, but I'm going to do my best. So it's 5% right now. But again, this is where I forgot my order of my slides. This is that picture that I just alluded to a few slides back of the flow from fossil fuels to plastic monomers and ultimately to polyethylene, propylene, and plastics. And the left side gives you the stats on where these lower middle income countries are going to be the biggest growth in plastic production, the biggest profit, but also the biggest growth in effects that they're going to see. They're going to learn the lessons we're already learning in chronic disease in the United States. But here's the stat that I quote a lot. It's 5% of carbon diet right now, planetarily, and it's 22% of the remaining diet that we have left if we're going to be at 1.5 C. Now, I'm not convinced remotely we are going to be able, we're already nearing 1.5 C, above 1.5 C. It depends on what the flow in a given year is, but probably closer to 3 C. But this 22% contribution to the growth, the inability to achieve 1.5 C, assumes conservative growth assumptions of the plastic industry, which have been vastly exceeded so far. So we are going to run this red light and beyond. And micro nanoplastics, as you can see below, impede our ability to deal with the carbon that we already have in the planet. So this is a multiplier effect from a forest perspective when it comes to plastic and their impacts on climate change. So I would be remiss if I also didn't talk about disasters. This is the East Palestine disaster you've probably heard about. It was, I think, a remarkable moment of a controlled explosion. This was an imminent, much more worse event that was about to happen. And they literally had this train car collision. We could have a whole discussion about infrastructure, but I'm not going there. The point being that the trains collided with vinyl chloride in there. There was a clear leak. This was an imminent explosion, so they decided to do a controlled burn. And there was an explosion, as you would expect, but it could have, I mean, you can imagine the scale here. You can imagine this would have been much worse had it not been controlled. It would have led to actually a broader population-based exposure to dioxin, because vinyl chloride burns, you make dioxin. And what we already know from that controlled event, which was the byproduct of some heroic intervention to save the day from it being much worse, we know there's more dioxin in the soil than it's a cancer risk according to the Environmental Protection Agency. The human biomonitoring studies are a little wishy-washy. The N is small, but watch that space because there's a lot of investment being put longitudinally in these populations. And I fully predict there will be an increase in cancer risk. Can't prove it until we see it. You never can, but we've seen that in the World Trade Center disaster where dioxin levels are as high as other disasters like in Italy and today. So I finally get to human health. Let's talk about it. Now, I've already alluded to the dimensionality of this problem. It's a complex and diverse mixture. It's multidimensional. Macroplastics are these very big things that you see in nostrils. That's not what we're talking about in human exposure phenomenon. You're really operating below 5 millimeters. So we're operating in the microscopic range or narrower in diameter. And the majority of the action is really in the dissolved organic chemicals. These are additives, these are monomers, and they're impurities. And they are a classical chemical mixture. That makes it also very difficult because we're used to doing one chemical exposure testing at a time. And so we really have a broad array of chemical complexity here. We have had the technology on the right to measure these chemicals for about 50 years. The notion of microplastics, by the way, was invented by Sir Richard Thompson 25 years ago. Just tells you how fast this field has exploded and how, dare I say, immature the field is. That's why there's controversy scientifically in measuring micro and nanoplastics. So at the same time, I believe these measurements, they are detecting micro nanoplastics. My point is that across these independent observations in different populations, different labs, we still don't have a handle on comparing apples to oranges. So I can't tell you that the New England Journal of Medicine recognition of carotid atheromas having micro nanoplastics use the same technology such that I can compare it to the placenta studies that showed plasticenta. Can't do it. We don't have standards right now in the field to consistently compare micro nanoplastics except for polystyrene. Now, ARPA-H, the Agency for Research Projects in Health, is investing a lot of federal funding to accelerate the filling of a huge gap, but I think you get my point. That said, as an epidemiologist, the way I was taught was exposure and precision makes it actually more difficult, generally speaking, to find effects rather than less difficult, especially for categorical outcomes. And so that paper, New England Journal of Medicine in 2024, was a big frame shift in the dialogue because you had a fourfold increase in heart attack, stroke, and death in relationship to polyethylene and polyvinyl chloride plastic. What is remarkable, again, that we're not so curious about the invisible, but we get very curious about the visible. And I'm not griping when I say this. A year prior, we had published a study documenting urinary phthalates, the chemicals that are additives to those same plastics, in association with cardiovascular mortality in a large US national cohort. Now, I don't say that to gripe. My actual point is if you think of causal criteria from Sir Austin Bradford Hill, I'm not claiming causality. You have two different exposure method measurements. You have two different ways of measuring exposure, two different populations, all showing the same readout. So the consistency there, when you add in the fact that biologically, we've already known that micro nanoplastics and chemicals do a lot of things to the vascular bed. They cause inflammation. They disrupt hormones that are key to metabolism. You have a large body of evidence that makes a strong and compelling case for action. So akin to what I said about the lead moment from the 1970s, where we have a lot of biological evidence and very early signals that are troubling. So I alluded to the chemical complexity as well. There are 16,325 chemicals in plastic based on current data. This number keeps going up. The next paper probably will hit 20,000. That's just how fast the technological developments are going. It was 10,000, then 13,000, now 16,000. That's why I'm projecting that. But the point that I'm making here is about that light blue on the left. We have no toxicity data whatsoever for 10,000 of them. That's because we assume that chemicals are innocent until proven guilty. That's true in the United States much more than across the world, but it's still a problem across the world. And so it's in that milieu that it's remarkable we know as much as we know on the right. And what I'm going to focus on from the evidentiary tip of the iceberg is roughly that 47 EDC on the right. That's how small a number of chemicals we've been able to characterize as problems really quickly. Am I imputing 50% of chemicals in plastic? No. But based on what little we've tested, what little we've assessed in human studies, as well as laboratory studies, tells us we have a problem. And that problem is particularly in these 5 categories of chemicals. I'm not going to focus on dioxins, so I'm going to really focus on 4. We're talking about bisphenols, monomers of polycarbonate plastics, and aluminum can lining, epoxy resins particularly, phthalates, additives to soften plastic that are in food packaging, her and polyfluoroalkyl substances. Does anyone here watch the movie Dark Waters, Mark Ruffalo flick? It's a story about the West Virginia contamination episode with PFAS. Highly recommend. It's an engaging movie. It is near and dear to my heart from the chemical safety perspective, but it's not really about the toxic chemicals. You just see the story and the impact on people's lives and the bravery of people to come to say something about the effects of these chemicals. They're used in nonstick cooking and oil and water resistant clothing. They're the growth space in plastic materials in particular. There are 8,000 some odd PFAS. That was the last number I remember. And they're these phosphorus and brominated flame retardants. I like my iPhone, thank you very much, not burning up. But that iPhone likely has flame retardants in it. And that flame retardant is not inert. There's a lot of dust in indoor environments that comes out from plastic materials. And we'll talk about steps you can take to reduce that exposure. A little harder than some of the other steps, but they're there. And this gives you a sense of the non-communicable diseases that are directly related to plastic chemicals. We're talking about obesity and cardiovascular disease. I know this is a pediatric audience, but I'm going to take a life course perspective because you have to in this space. Kids are uniquely susceptible to these because pound for pound, you know this, they eat more food, drink more water, breathe in more air, they have developing organs that are more susceptible, they have longer lifespan that manifest chronic diseases. So nothing I'm going to suggest here doesn't magnify the reality that kids are susceptible. We should be protecting kids. But life is the window of susceptibility to these chemicals as this will manifest. So I'm going to treat some of these outcomes in turn. I'm not going to be able to give it, I could do 4 different lectures on each of the different disease categories, but that's just not worth it. It's really about getting you to the safe and simple steps of action. What in particular is the strongest evidence for plastic chemicals is the effects on developing brains of young kids. Because we know that baby relies on mom's thyroid hormone through 2nd trimester pregnancy. Subclinical changes, so nothing an obstetrician can detect, they'll just read out as normal thyroid hormone and TSH, so normal T4, TSH, whatever your metric is for measuring thyroid hormone function in pregnancy. In that clinically normal range, subtle changes produce deficits in cognition, as well as increases in clinically significant autism, attention deficit hyperactivity disorder. And we know that brominated flame retardants are directly chemical similars of thyroid hormone. Not to mention that phosphorus-based flame retardants produce the same anti-thyroid-based activities. We have had 4 longitudinal cohorts controlling for social determinants of health, for other environmental exposures that all show the same signal with decrements in IQ. So at this point, again, we have robust evidence. What is to me equally frightening, but needs some more further verification in different populations is this. I don't usually do mediation in a general clinical audience slide, but I'm just going to explain it in simple English because the point is actually about causality and causal, at least inference. So this study looked at this is a Dutch cohort, looked at phthalate exposures in pregnancy and IQ. They showed a decrease in IQ, but then what they did is they didn't just stop at the neuropsychological testing, they looked at magnetic resonance images. And they showed decrease in gray matter in association with that same prenatal exposure. So again, 2 independent observations of outcome, same exposure, 2 different effects. Then they did a statistical method called mediation. They asked, is the decrease in gray matter explaining the decrease in IQ score? And yes, that's what all those betas and p-values are. The bottom line is it's a very strong explanatory factor. And because the natural direct effect is actually non-significant, it means it might actually be the major driver of the observed effect. Now, I could draw a further map and put thyroid hormone somewhere in the pathway because at least in our New York City cohort and elsewhere, we know, and you don't look at the numbers, phthalates are a very strong driver of maternal thyroid hormone function in epidemiologic studies. So suffice it to say, we can connect the dots all the way from thyroid hormone disruption to growth of brain in baby and all the way to decreased brain size and IQ. We also know that phthalates contribute to babies being born too soon. This is from a large US roughly representative cohort called the Environmental Influences on Child Health Outcomes Program, or ECHO. What to me is frightening is not the decreases in gestational age and the increases in premature birth associated with DEHP, a major phthalate used in food packaging. But in this space, I already alluded to this innocent until proven guilty notion. You say a chemical is a problem, industry says, okay, we'll change the chemical. And then the chemical that it's replaced with, in this case, is associated with a greater relative risk of premature birth. So we didn't just whack the mole, we made the problem worse. And that is what is disturbing. I'd like to do burden of disease statistics. Ethan alluded to this in my bio. And the reason I bring up this statistic is we're talking about 5 to 10% of premature births. We're not talking about 50%. Anyone who tells you that a multifactorial condition has a 50% explanation due to one risk factor, you should really take with some skepticism. So, but at the same time, 5 to 10% is 50,000 premature babies, $4 billion in economic cost, not to mention cognitive deficits and lost economic productivity. Because we know that babies born too soon haven't had enough time in the oven to grow their proverbial brains to the mature final term size. So pretty strong evidence from multiple different cohorts across the United States and globally. The evidence that chemicals make us fatter is pretty broad and diverse. It comes from a few different strands. I put the numbers up here for the research savvy, nerdy people. You just can listen to me if you prefer. But my point being is that they do different disparate mechanistic things. So phthalates don't just make babies born too soon, they shrink growth in the womb. And there's this hypothesis Sir David Barker came up called the thrifty phenotype, that when you have environmental insults that shrink baby's growth development, the baby adapts to a thrifty phenotype in which they are more avid at keeping calories out of the womb and thereby having increased obesity and cardiovascular disease in later life. So that's one of the mechanisms that we understand to be at play. We also know that bisphenols, the chemicals added to can linings and thermal paper receipts, are modifying mesenchymal stem cell fate. So our stem cells are programmed to be bone, muscle, or fat, for example. They shift the fate from bone to fat, such that in this birth cohort I'm alluding to, we saw decreases in bone mineral density at age 10. We know that you peak bone mineral density is 20, and you decline from there faster from a lower number, you are going to have a higher risk of osteoporosis in later life. So there are these early origins of adult disease that take many forms. In addition, and this is to me very frightening, is that phthalate exposure was associated not with total body mass, which, as you may know, is an index of bone, muscle, different depots of fat. In this case, it was associated with fat around the heart, which is the most problematic cardiovascular risk factor that folks have described in youth in particular. Now, I've alluded to the fact, this is not a pediatric slide, that life is a window susceptibility to these chemicals. Phthalates contribute as a result of adult exposure to cardiovascular disease, probably through a couple different ways. One is that they're anti-androgenic, and low T in men is a marker for a predictor of adult cardiovascular disease. They also contribute directly to inflammation, largely in both sexes. And so what we know is that across a longitudinal study, we identified 50,000 early deaths between the ages of 55 and 64, peak earning years associated with $23 billion in lost economic productivity. So we have a bigger problem across the lifespan. Bisphenols, chemicals I alluded to earlier, are associated with greater carotid and media thickness, severity of coronary artery disease, reduced heart rate variability, which is a harbinger of cardiovascular adverse outcome, not to mention all-cause mortality and cardiovascular mortality. They're also associated, please forgive the small font, incident diabetes. Again, here it's bisphenol A and one of its replacements, bisphenol S, that are associated with disease. Bisphenol S is not excluded as an exposure in BPA-free can linings, for example. So when they market BPA-free, there are 140 replacement bisphenols that are out there that we have to think about. It may be natural, by the way, and different than a synthetic lining, but we don't know. I haven't talked a lot about PFAS. I won't be able to give it the full justice, but we know they contribute to growth restriction, which sets you up for childhood obesity and adult cardiovascular risk. We also know that in adulthood, it's associated with diabetes and weight gain. The reason I add this slide in particular is in one study where people lost weight through healthy diet and physical activity, they measured serum PFAS and they found increase in weight gain back. And when they looked in further, they found the decrease in resting metabolic rate explained the gain back in weight. And all of this is to say, if you were to watch the Netflix documentary, you would probably get an hour's worth of information about infertility. I'm going to give you one slide. It's not to minimize the import, it's just that I only have so much time to cover all the things I would like to cover. We know that phthalates are anti-androgenic. I already alluded to that. That anti-androgenicity manifests in a couple of different ways. From male reproduction, it leads to reduction in the anogenital distance, which is a marker for anatomically of sex hormone imbalance in utero. We know that short AGD, which in boys reflects a low testosterone state, is associated with infertility in adulthood, and the AGD you have as an adult is largely the AGD you're born with. There's a little spike in sex hormones in mini puberty through 4 months of age that contributes to AGD, but what you have in your proverbial taint as an adult is the anatomical distance that you have in infancy. And we know that adult exposure has also, select populations and fertility clinics and such, have also associated chemicals in plastic with decreases in fertility outcomes. So this isn't necessarily a global health audience, but I just do want to emphasize that where you live in the world and what you do for a living and your economic situation does contribute to exposure. And particularly for waste, if you're picking waste, there are a lot of women of childbearing age who are picking waste across the globe. And that's a vulnerable population by definition. So thank you for being patient with me with all the doom and gloom. There are safe and simple steps we can all take to reduce our exposure, and we need to advocate for policy action ultimately. What I can tell you is that many of these chemicals have what we call short half-lives. That means they get excreted renally in 2 to 3 days. And in one study, as you can see here, they decrease phthalates through dietary interventions and bisphenol A 30% in a couple of days. So if you sustain that intervention, you can have medium-term consequences for hormone health. And if you sustain that intervention in the longer term, you're talking about reduced chronic disease risk profile. So there are short, medium, and long-term gains. It requires sustaining interventions, right? So that's going to be the rub, much like dietary interventions for obesity. Now, a lot of people tell me, well, Dr. Trasande, your interventions only work in high-income people. That's not true. This is a low-income population where they didn't just read the label. They worked out a system to look at cosmetics and personal care products in teenagers. And look what happened. Same decrease with respect to dietary intervention. That previous study was around 30 to 40%. This was 27% in 3 days. So there can be a palpable change in urinary levels of these chemicals because you can excrete them out. The problem is there's continuous exposure, and so if you don't control your exposure, you have a change in exposure back to the median. We also know that these chemicals live in dust. This is a much more involved intervention. I don't advise doing this in a hospital setting. Maybe in real time we do this implicitly, but the intensity of a healthy buildings intervention was associated with intense reductions, the intensity of reductions in PFAS, in brominated flame retardants, in their phosphorus-based replacements, and I don't have a slide that depicts this, an intervention during the pandemic, those Corsi-Rosenthal filters that put a fan surrounded by MERV 15 filters, reduced dust levels of PFAS and phthalates by 40%. So anything that people tell you about infectious disease transmission doesn't really give justice to the broader consequences for these viruses and bacteria. We know they travel in air, so does dust, and dust has chemicals in particular that may be of concern. So This is people's favorite slide to take a snapshot of. I'll just highlight that because it's, to me, the safe and simple steps elevator pitch that I give to everybody if I have 60 seconds. Canned food consumption is a straightforward way to spike your bisphenol levels. They did this in a bunch of college students. I don't know how this got past the IRB, but they spiked bisphenol A levels at Harvard students by 1,200%. They do strange things at Harvard. Please do not microwave or machine dishwash plastic containers. You're just inviting micro nanoplastics, which I don't know that much about, but I know a lot about chemicals in plastic. And those plastic chemicals get into food that way. A lot of these plastic water bottles now are ones. They've done a bang up job of hiding the recycling numbers over the years. But there's this recycling triangle, right, that usually has a number from 1 to 7 in it. 3 is for phthalates, 6 is for styrene, polystyrene. Styrene is a known carcinogen. 7 includes the bisphenols. I'm pretty sure this is a 1 because I've just been through so many different talks and had discussions with the Pure Life Nestle people. By the way, you are really buying the plastic water bottle. You're not buying the water. I just want to make that infomercial for a moment. So tap water is a good thing. We'll talk about tap water and what to do about it in a few minutes. But please use stainless steel or cast iron instead of nonstick cooking materials, and vacuuming and wet mop work very well in addition to recirculating air. Now, I use this picture because when I'm thinking about how we manage this at NYU Langone Health, it's evolved because NYU Langone used to be a system that was really only taking care of patients in the 5 boroughs of Manhattan, where we get our water from the Croton Reservoir, which does not have PFAS contamination. It's regularly testing minimal. That's a whole land grab story that's worth a historian lecture in of itself. But we have started to expand our footprint into Long Island, and this map is really great. It's by Environmental Working Group. I do not have a disclosure to communicate with EWG. I just like what they've done graphically. And you can see various lighter blue spots rather, where there are levels of PFAS above the limit of that the EPA, even in the current administration, agrees is problematic from a human health perspective. So it's in these populations that I do suggest water filtration. And I've already alluded to before this notion that 150 million Americans should get their PFAS tested. This is literally coming from the National Academy's report. They also suggest workers who work with fluorochemicals or do firefighting foam should get measurements. And again, this test is the kind of CLIA certified test that people should be getting. The problem is that insurance companies are not agreeing to cover it. And if you're in New Hampshire, that's the only state test is required for coverage. New York just put some bills in the Assembly and Senate to advance in that regard. Why does biomonitoring matter? Why not just filter the water after all? I agree with filtering the water, don't get me wrong. But the reason that you should do PFAS testing is that you can intervene to modify dyslipidemias that are extremely strongly associated with PFAS. There are increases in breast, testicular, and kidney cancer risk to keep in mind. I think obstetricians don't really emphasize this, but PFAS is a very codified risk factor for hypertensive disorders of pregnancy. And hypertensive disorders of pregnancy do imprint cardiovascular risk beyond the pregnancy period. So there's lots of reasons to think about these exposures. The National Academy also suggests more routine thyroid hormone testing in levels above 20 nanograms per milliliter, which is roughly 9% of the US population for the sum of the 6 PFAS they suggest testing for. Now, there are a variety of water filtration methods. I apologize, I should have updated this sentence in the slide. That is a fragment, and I'm sorry. But suffice it to say, there are a couple categories of methods. Some are cheaper than others. Whatever method you use, the key is making sure your filtration system continues to function. So if you're using a carbon-based so-called Brita or other company, I don't get money from Brita, I'm just giving them free props there. But a carbon-based filtration system only works if you change a filter. It doesn't remove everything. It doesn't remove PFAS as effectively. We were looking this up last night. The levels of PFAS, as far as we know, in the I'm going to butcher the name, the Boise water system, Alveolus or something.
Veolia.
Alveolia, thank you. Okay, so I was close. They're pretty low actually, so they don't trigger the kind of interventions that I would suggest perhaps in certain parts of Long Island where you know that reverse osmosis starts with a carbon treatment, but then uses some semi-permeable membrane to diffuse out the chemicals of concern and make the water that's left safer. But EWG has a great website where you literally can type in zip code and it will give you the available data. It's not perfect. Well water is a real problem. We were talking last night, there are some other contaminants to keep in mind, and that's why the carbon-based filtration in this community might be a good way to go. There are a lot of marketed systems that are still pricey. I should probably cut out Andrew Huberman's picture here in that he's another influencer who I guess is getting free advertisement by virtue of my slide here. But, suffice it to say that at home we do use, just for the record, so you know what I do, we have both systems available to us. We have a filter in our refrigerator that we swap out that's carbon-based, and we have this system that imitates reverse osmosis. I can't tell you we use both consistently, but in New York City water, either will do because we have similar water to Boise in terms of the contaminants we think about. This slide gives you the New York City version of this same example. What I like about the EWG system, it doesn't just tell you the contaminants, it also tells you what methods will work for what contaminants you're worried about. So back to what else do you do about it? I can't tell you, there's not a clinical intervention. This would be the proper basis for a randomized control trial that either of the methods depicted here work. I can tell you there's plausibility to both because the microbiome may be disrupted by plastics, microplastics and nanoplastics and chemicals used in plastic. And it might be that the microbiome is the reason or it's digesting or modifying the plastics to create them as problems. I just don't know. And there's a lot of, this is a space to watch because if there's going to be anything that you could so-called chelate or avoid exposure, it's probably gut that's going to be the biggest mechanism. I understand air filtration is great, and I'm steeped in the body of knowledge of air pollution, but if I'm going to give you the personal perspective of what the biggest source of plastic exposure is in the United States, it's diet. I can't prove that because we haven't had a systematic study that EPA used to run called the National Health Exposure Analysis Survey that would literally take dust, water, food, and put together an exposure mapping. That last time that was done was in the 80s. So not really a good, that was in a different plasticine. That was not in the plasticine firmly. So I think I have maybe a smidgen of time for questions. I do want to talk about policy actions in the US and globally. This is a space where there is actually substantial alignment, okay? I give vaccines. Just when I practiced, I gave vaccines. I just want to say that before the next picture comes up. But suffice it to say that ultra-processed foods, for example, are a major source of plastic exposure, particularly phthalates. And we've written that this is something that we need to think about. Now, that has led me to an unusual road where I've had the privilege of sitting on a panel with Secretary Kennedy a few months ago, where I saw him say right out of the AAP, I think he knew it was the AAP statement on food additive chemicals that I helped write. And he literally talked about every single science-based step as though he were delivering it cold. I don't know what to tell you, but it speaks to alignment with people who you might not think naturally would be your partners. And my philosophy approach right now is to partner with people where you can and get where you can go. And I had the privilege more recently, about a week ago, of being at the announcement of the EPA HHS initiative on microplastics as well. So I'm of the approach that we need to lean in where we can and do what we can.
Just foreshadowing the maroon suit there. I liked it.
Yeah, indeed. That is the suit for tomorrow, by the way. So again, that's a great one. Thank you for highlighting that. That wasn't intentional there in Charlotte, but that's what happened. Now, I have, as Ethan alluded to, had the honor to participate on behalf of the Endocrine Society in the Global Plastics Treaty negotiations, not as an active participant, but as an observer, to emphasize the point. And one of the things that's remarkable here is A, global diplomacy can still work. B, global diplomacy can incorporate science. When I started this process, there was a pre-meeting in Senegal in late 22 rather, it's there. In mid-22 that I participated in. Health was not on the agenda. This was an ocean plastics treaty. This was just, well, it's a waste thing, not a life cycle thing of plastics. Here in 2025, there's a reason we don't have a treaty, and it's largely because 90 countries insisted on human health being at the center of the treaty. It was not originally a health treaty, but WHO is now an extremely active participant. So as much as people might get a little down on global diplomacy these days, there's a lot of opportunity. And this process, like the Paris Accords, is dragging out. The difference between the Paris Accords and this mechanism is it's a legally binding instrument. And that's actually probably the biggest reason why there's a holdup, because once this treaty is signed, it's international law. The Paris Accords are aspirational in contrast. So that's a big nuance of difference there. I'm just going to now talk about the science at the center of the debate. We come back to reduce, reuse, and recycle. We have been told that recycling was the way out of the plastic crisis. Scientifically, I just can't support that. We know that recycled plastic actually can have higher contaminants than virgin plastic. So as much as I like to rave about recycled water bottles, and I'll drink from recycled water bottles if I have to, the fact is they actually are more energy wasting in terms of the energy to recycle them. And we need to focus more on reducing and reusing what we have. That's something that we have been lulled into assuming is not a solution. We focused on one of the three R's. Bioplastics is a space to watch. I'm not totally against it. They are climatogenic in their problematicness because they also, again, require heat and high temperature and other conditions to reuse it. Or recycle it rather. And what we know is that they're as inflammatory and anti-androgenic. So we need to measure globally the exposure. The data we have at exposure are largely US, Europe, Canada, and a few high-income countries. We don't know a lot about low-income countries, and it will help us to measure in low-income countries because we live in a global planet where products fly all over the place. And so we get exposure from places across the world. Now, the last thought is we have to address the unknowns. We have 10,000 chemicals we don't know about. And I would argue we're in a place, I'm gonna, again now, instead of hearkening to lead, I'm gonna augur up the history of carcinogen. 60 years ago, we started a UN agency in WHO called the International Agency for Research on Cancer. That was a similar scientific moment in understanding. We didn't understand cancer back then. Then we put a war on cancer in place globally. And we know a lot more about carcinogens, and we have a lot of independent political free knowledge that contributes to what countries do or don't do in the space. I would argue we're at a similar moment with endocrine disrupting chemicals and those in plastic, not to mention pesticides. You could throw them in for good measure, or you could fight about it. But suffice it to say that we have a lot that we can do about these important issues that require science and clinical knowledge. And with that, I'm going to leave you with a plastic human to consider because we are all too plastic as a human species. Looking forward to your questions. It's a joy to be here.